Hi there, my name is Edgardo David Arana. I'm an X-ray tech here at St. Mary's Urgent Care, Apple Valley, California, and today I'll be talking to you about asthma. Asthma is a chronic disorder that narrows the airways and makes it difficult to breathe. One of the biggest complaints that we get here from patients, being seen as a patient, is cough and congestion. They'll come in, we'll treat them, do what we have to do, and they'll be on their way. One of the biggest things is that the little patients, our little ones, are pediatric patients, anywhere from 1 to 3 years old, anywhere from young adults, let's say 12 to 16, 12 to 18, might have history of asthma without even knowing it. So today I'll be talking to you about possible triggers, medication treatment, and health literacy of what the patient should do to follow up and what information we should disclose to our patients. So again, first things are triggers. Triggers could be anywhere from cold air, exercise, dusty environments, exercising in very hot, humid conditions. And other things could be like marijuana use, vaping, secondhand smoke, or even just smoking cigarettes. We'll get patients that come in here, possibly reeking of any of those three things I mentioned, like marijuana, cigarettes, or even vaping, and they have known history of asthma. And they always ask us, why do you think I cough a lot? Why do you think this is going on so much? Well, it could be because of what the clothes smell like. So we'll treat our patients, we'll let them know what's going on, we'll take them back here as medical assistants, bring them back here, ask them their medical history, get their vital signs, put them in a room, ask them if there's any known history that we should be aware of. And again, our medical providers do ask those questions to our patients. They want to know what's going on to better treat them and associate the issues. One of the second things is the treatment. So right here scattered around me, we have treatment for medication, we have the breathing machine, and we have an oxygen tank. These things are there to help our patients get stabilized, feel good, to make sure we leave them in that sense that they got treated here in the office, to be about their way, that they're stable enough. Again, we're in urgent care for acute treatment, but we always advise our patients to go see the primary care physician for anything follow-up. Some patients, most patients, don't do that because once they feel good from here, once they get better in a couple of days, by the time they have that appointment with the primary care doctor, they're like, oh, I feel good. We should always have it where we iterate that on our patients. See your primary care doctor regardless if you feel good or not. Let them know what treatment was done here in the office, and if there needs to be any further evaluation from your primary care physician. So when patients come in here with those symptoms, shortness of breath, chest pain, history of asthma, they need a medication refill, we'll handle all those things. But again, it's that little part where the health literacy falls into action, where they do not see the primary care physician. We'll give them a breathing treatment with a medication to help control the cough and congestion. And sometimes it's just as simple as that, where it's just cough and congestion, but they have history of asthma. So our doctors will prescribe a inhaler, albuterol, Ventolin. They'll get treated for that. But long-term thing, if it's something chronic, they do need prescription for the treatment machine right here, which usually comes from the primary. Urgent care could try to attempt to prescribe this, but the insurance always has the last word, where nope, it wasn't prescribed by the primary care doctor, we're not going to give this. Same thing with the oxygen. We have this big one, very old school. Now they have the handheld ones that go around the waist to help our patients, the ones with the COPD and history of asthma. So again, it's the thing where we need to tell our patients, you need to see your primary care doctor and make sure you see your primary care doctor. And it should come from us, where we follow up on our patients to see if they have met up with their physician. Now, the third thing will be health literacy, where we tell our patients, do this, this, and that. We should give them a brochure of possible reasons for exacerbation, what treatment options there are to get done, again, to see us, get medication prescribed, and what triggers that could be giving them symptoms that they should stop doing. Patients have the tendency to think that because they got medicine, they can keep doing the same thing. Cough and congestion is a common thing all year round. But asthma, if it's chronic, again, chronic being a big word, could be a lifetime thing. It could be anywhere from as a kid to adolescence to where it grows with them, part of their life, it's something routine. That was almost brushing your teeth. So again, it's our job as medical assistants, medical providers, physician assistants, DOs, MDs, to iterate that on our patients. Go see your primary care doctor after today's visit and make sure you keep that appointment regardless if you feel good or not. Because he or she might request a chest x-ray to see if there's anything that needs to be done in detail. And we're here to help you for the moment, acute versus something chronic, see your primary. And again, it's our little ones that have the difficulty talking about themselves. That they might have chest pain, it hurts when I cough, breathe. Sometimes Robitussin, children's cough medicines given at home by mom and dad, and just it's not enough. That maybe they need to come see us, get that breathing treatment, that little inhaler. They'll get it done. But again, because they feel good, they're a lot better, they won't see the primary care physician. And is that where it's very important, because asthma exacerbation is a big deal and it is common. A lot it's with our little ones that can't speak for themselves, that they won't tell mom or dad. They'll keep it to themselves for a long time, saying, it hurts, mommy, it hurts. We'll get patients, and we have this right here in front of us. It's an iPad where patients check in on the front office right there. They'll tell us shortness of breath. We'll take that consider very quickly in the back office, see them, treatment. Sometimes it might just be cough and congestion, or it might be exacerbation of asthma. We'll put them on oxygen. We'll give them a shot of steroids, salmeterol, to help control the breathing because of inflammation of the bronchiole in the lungs. But what I suggest is that we give the patient a brochure of what should be done, because verbally, I can tell you. Is it going to stick in here? I don't know. But as long as you have a piece of paper in your hands from your visit, from your urgent care doctor, and you take it to your physician whenever you have your appointment set up, it should have it where it says in your mind, I need to see my doctor. So again, my suggestion is having a brochure for our patients to take that with them. Because another thing is, that language barrier could be the issue as well. Even though patients' first language might be English, some of our doctors here might have a thick accent, and they might not be very understandable, the communication-wise from our doctor to our patient. Like, what did the doctor tell me? Is the doctor going to prescribe any medicine? I wouldn't know because I wasn't in the room. But we do have in our computer set up right here where we'll see the dictation from the doctor what medications are prescribed. And that was already reiterated in the room with the patient, just the patient didn't hear it clearly. So sometimes it's a language barrier. Some patients might not even speak English at all, and that's another thing. We have medical assistants here who could translate. Some speak, well, let's say Spanish, Vietnamese, Cantonese. But it's enough to translate, but medical jargon might be in between where like, who knows? And one thing that St. Mary's has taken that into consideration is having an iPad in place where it translates FaceTime with anybody, with any language throughout the world, to our patients to be like, this isn't going on in detail. But again, even with that being explained to our patients, that language barrier sometimes is an excuse, it's not an excuse. So I suggest, again, a brochure for our patients, telling them these are possible triggers, these are the treatments that were done here in the office for you, and what you should do as a follow-up to see your primary care doctor. In paper, so having that physical thing in their hands might be just enough to get our patients to lower their asthma, to make less visits to the ER. Again, not that they go to the ER, but small things like this, is like getting your blood pressure checked, brushing your teeth, simple things like that. See your primary, there should be less visits from the ER for asthma, chronic issues, COPD, bronchitis, anything like that. I thank you for your video and thank you for your time today. Again, I'm Gardo Arana, X-ray tech medical assistant here at St. Mary's Urgent Care, Apple Valley, California.